Heart disease is common in the United States, but the realities of military life may put veterans at an even higher risk of developing heart problems. Veterans experience circumstances and exposures that may make them even more likely to develop heart disease than the civilian population. One 20-year study suggested veterans may be at a higher risk of heart disease, in part because they also have higher rates of other chronic health conditions and depressive symptoms, as well as more exposure to trauma. If you're a veteran with a heart condition, you may be eligible for compensation. Heart disease is an umbrella term that covers a wide range of conditions. The VA rates heart disease at 10%, 30%, 60%, or 100%, depending on the severity of a veteran's symptoms. The METs used in the VA's rating system refer to the ratio of your working metabolic rate over your resting metabolic rate. This is basically just how difficult each of these tasks are for you and what kind of strain they place on your body and your heart. The VA rates heart conditions based on the amount of fatigue or breathlessness that is experienced at different levels of exertion. So one example would be breathlessness that's produced when you're standing at the kitchen sink doing some dishes. That would be indicative of a pretty severe level of heart disease that would warrant a higher rating. Another level of heart disease rating could be based on breathlessness when you're going upstairs or when you're mowing the grass or doing something more strenuous like yard work outside. Typically lower to moderate level heart disease ratings fall in this range. The VA also considers any heart surgeries that are needed for the condition. Procedures such as cardiac transplant surgery, heart valve replacement, or having a pacemaker implanted can result in a temporary 100% disability rating. This is also known as a convalescent period. And this rating, once it's provided to you after a surgical procedure, is subject to re-examination. The VA will reassess your heart rating based on your new METS levels following your surgery, and you could see a reduction from the 100% disability rating down to where your current baseline is following the surgery. However, some cardiovascular conditions have their own diagnostic codes. These conditions have their own rating criteria, like peripheral artery disease. That's diagnostic code 7114. If there is not a diagnostic code, this does not mean your condition isn't eligible for VA disability compensation. Instead, the VA will analogously rate your condition using the most similar rating criteria available under another diagnostic code. You can learn more about VA benefits for heart conditions by following the links in the description box of this video. If you have more questions about VA benefits in general, watch some of the other videos on our YouTube channel. You can also leave your questions in the comment section below. If you're wondering if you qualify for an increased rating or TDIU, contact us at Woods & Woods for a free consultation. Click on the contact page in the description below this video or call us at the number on your screen.